So as we know, AML in pediatric patients has an incidence of approximately 7 cases per million children under the age of 15. So this is a very important issue in peds. And what we know is that when we are talking about transplant in this disease, we have the indication to transplant patients in CR1 for high-risk patients and in all patients for CR2. But importantly, most of them, 70% of them, can't find a haploidentical donor, nor 40% of them can find a match unrelated donor in international registries. So our rationale was to compare the use of mismatched grafts in this kind of patients. And what we found comparing the outcomes of UCB and haplo with PTCy in more than 250 patients was that there were comparable outcomes in both of the groups, and we also had chronic GvHD, which was actually the only outcome which was not comparable, as it was significantly different between the two groups. And what we found with a p-value of 0.019 of difference between the two groups was that haplo recipients with PTCy had a high risk of chronic GvHD. So, of course, we will have further implement prophylaxis for these kind of patients, because, as we know, chronic GvHD in pediatric patients is a very important issue. And so we have to prevent that in order to have a better quality of life. But still, we had comparable outcomes in these very useful resources of different donors, and we can have cost-effective and ready-to-use different kind of transplantations in this very bad disease.